We offer shelter for 50 women through the winter months. One of the things with WRP that's different is that we have a harm reduction approach. So with a harm reduction approach, we're meeting the women exactly where they're at. So therefore, if they're struggling with substance abuse or they're struggling with perhaps mental health issues, we try to identify those in the WRP program, put in appropriate supports, remove some of those barriers, and it makes them more easily housed in other programs because of that. We're reducing harm not only to the individual, but we're reducing it to the overall community. When we're dealing with people who've been disenfranchised and had a lot of difficulties over time, we do not expect that we're going to see immediate sobriety, immediate solution to these problems. And what harm reduction does is reduce harm slowly, step by step, in a conscious way, to be able to embrace wellness, not just for the person, not just for the company, but for the entire Calgary community. And that's the essence of harm reduction. Women become homeless for many reasons. We have had women down in WRP who were rendered homeless due to the flood in Calgary last year, due to family breakdown, due to a health breakdown, due to an employment breakdown. So we see people from 18 all the way up to 70. Last year, our oldest recipient was 81. So do we have homelessness? There's no question that we do. Can we eradicate homelessness, which I think is a more important question? Yes, we can. But what we need to do is not stigmatize women as being homeless, but rather ask, what is it that we can do to remove the barriers for you? Our medical well-being, our physical well-being is such a big piece of our overall well-being. And because our programs are funded where women are being put out on the street at 6 or 7 in the morning, it makes them emotionally and physically exhausted because they have to kind of move from pillar to post from 7 in the morning until they can return to the shelter at 8 at night. So when we look at wellness and when we look at medical concerns, we must look to the simplest solutions such as good nutrition, exhaustion, rest, and self-esteem. There is not one night that I go down to the WRP program that I'm not thanked by all of the people that we offer safety to. So there is no question. And those who feel it, they know it the best. So if our clients are happy, then the Y should be very proud to be putting on this program.